This is Dr. Nucci from Nucci Medical for our coffee talk today. And of course, I have my coffee for the coffee talk. I actually had some already, so I'm good. Today's talk or discussion is going to be about stem cells and the spine, stem cells in the spine, and some applications potentially for stem cells in the spine. I think really the bottom line is there's still figuring this out. There's no great answer just yet. But I think it is important to talk about stem cells to begin with, and then what application they may have in the spine now and potentially into the future. There's been a lot about stem cells that have been said and so on. And one of the challenges with talking about stem cells is knowing what you're talking about. There are different levels, essentially, of stem cells. And I think the best way maybe to start with is an explanation of where we begin, right? What the start of it. And you have, you start with one tissue initially, embryonic one tissue. And that tissue, or those cells, initially break into essentially three separate parts: endoderm, mesoderm, ectoderm. That they break into three. And those are true stem cells. Those are the cells from which all the other organs, everything in the body develops, those three pathways. They're committed pathways, essentially. And as you move down, like with mesoderm, for example, you go down another level to cells which become more committed and then more committed. So the mesoderm cells in that tract make bone, they make muscle. The ectoderm path makes skin and nerves, and so on. So, and the endoderm is a bowel and so on. So it goes different paths, but it's not a straight line. It goes down to cells that are not that committed, where we have nothing, no mesoderm, no endoderm, no ectoderm, they all just one, and it breaks into three. And then each section continues to drop down, sort of like a family tree, and essentially. And every generation becomes more committed to one pathway until you get down to the skin cells or the muscle cells, whatever it's been developed into. So it's true that the stem cells can develop into anything theoretically, but the stem cells which are available are not, certainly we're not using the endoderm, ectoderm, mesoderm per se. In fact, even if we did, we don't really know how to make it do something, how to make it go down the path to go from mesoderm stem cell to a tendon in your finger. I mean, the pathway down is multi-level, and there's a lot of other extraneous steps that go along the way that has nothing to do with the stem cells themselves that make that happen, interactions and so on, very, very complex. And we don't understand that. But when people talk about stem cells, I'm going to take stem cells. We're not from a patient, for example. I'm going to get your stem cells and we're going to inject them into your spine or your knee or somewhere else. You're not taking mesoderm. You're taking cells that are much further down the path from the mesoderm, from which is the origin. So in your bone, like in your bone marrow, you have cells which are committed. You have red blood cells and white blood cells and so on. And you have cells which are more pluripotential. In other words, they have the ability to become a white cell or a red cell or an eosinophil or whatever it may be, down further, generations down from that original parent mesoderm tissue, down now to these cells that can go sort of one way, or the other. So when you remove marrow from someone's pelvis, you remove marrow from spine, actually has a lot of marrow in it, you'll have these pluripotential cells that are stem cells per se, but they're committed to a great extent. They're committed cells. You're going to go one way, or the other. They're not going to form brain tissue if you're taking it necessarily from the pelvis, because that's more mesoderm cells. So one has to understand when you're talking about stem cells what you're really talking about. These are really committed cells that aren't quite committed in one way versus the other. And the question is, where do you get it from? I mentioned the bone marrow, and it does have not a huge number, but it has these cells which can go multiple directions, these pluripotential type cells. You can get the spine, actually has, quite a bit of them also. And they're actually, when you could draw it from somebody's vertebral body. So that's what we're essentially dealing with. One of the questions, for example, was to get these stem cells that are committed, but we want them to do something, and we're interested in bone first. Let's say I want to create more bone. Somebody has not enough bone, you want to make more bone, or you want to have a disc, you want to make more disc tissue or healthy disc tissue. Where do you get these committed stem cells? One is from marrow. Some people say, no, let's take it from fat. That's better because it's the same mesoderm is making both these end products. Turns out it's probably better from bone marrow. The cells are committed more to bone than to fat. So we did learn that. So got to get the right cells. So let's start with that. Those are what people are using when they're talking about stem cells. Another factor that is important, I think, is peripheral, but I think I should mention it, is it's okay to use your own stem cells. You draw out your bone marrow, you isolate the stem cells, you inject it in some area of the body. That's okay. What's not okay is taking your stem cells or someone else's stem cells and putting them in a freezer and using them later on. That's no longer something you can do. At one point, it was possible, in my understanding, but now that's not illegal. Can't do that anymore. You can't do that stuff. And with amniotic stem cells, they're not stem cells per se. They're the fluid around the stem cells, and they're not the actual living stem cells. And that may too now not, and I believe not something that you can legally do. But regardless, your own stem cells, you could use it. So if you could draw off some blood from your bone marrow and isolate your bone marrow stem cells in quotes, and inject that into some area with the idea that it will regenerate or grow or do something. One of the things that I think people do and also need to understand is there's no pathway for it to happen. In other words, the stem cells require signals to go along the path to do something. Those signals are not available when you just inject it somewhere. You're basically hoping that there's some signal that will do something good. Really, that's not been really worked out. What it does do is it probably does stimulate some healing, some generation of cells in really an unknown way. But to go to really the topic, talking about injecting stem cells into the spine, people do it. Some people charge a lot for it, and some people talk about great success of changing the color of a disc or changing the buoyancy of a disc and so on. But it's a very crude, in the sense that we really don't understand what pathway we're actually going along when we are injecting it. You sort of have this long pathway to go from mesoderm to disc. There's all these different steps along the way. There's all these different influences, all the different levels, and you're basically taking stem cells or marrow stem cells and injecting it into one part of that long cascade and hoping that it'll do something, and all those other things that are supposed to happen are going to happen around it in some way. Very, very well, not really very well understood, but people are hopeful that it will help, and they're trying to figure it out. As a treatment, it is, I don't like to use the word experimental, but it is experimental. We don't really know what's going on. But in some studies, people do well with injection of stem cells from the marrow into their disc, into their facet joint, which are little joints in the spine. We've talked about that a lot before in the back, little finger joints in the back, sort of finger joints in the back of the spine. You inject in that area. Some people inject it in and around the nerve and so on. Not very consistent on how well people do, unfortunately. And the spine is an unusual animal anyway. I know some of my colleagues do inject stem cells into patients' own stem cells into a knee, and they get very good results, at least anecdotally good results, not necessarily transferable, to the spine. So a lot more work to be done on stem cells. It's being injected in different places, off-label, so to speak. We're using these treatments without tremendous amounts of evidence. However, one has to learn too. One has to get evidence. So you have to do things that are safe to learn. So you may find out that, for example, we found out that probably stem cells taken from marrow is better than stem cells taken from fat in most instances when you're injecting a disc or a facet. Not everyone agrees with that, but that seems to be what's the most likely, and it seems to work the best for what they're looking at. But we're trying to figure it out, and as we go on, we'll probably figure out even more. But this is very rudimentary with stem cells. We don't really know exactly what is happening, and as I said, the idea stem cell, you take it, you put it in a thing, and you grow a liver. No, not the way that works. It doesn't work that way. First of all, there's not that kind of stem cell that can even do that. And secondly, a lot of other factors, along the way that need to happen, in order for that to happen. And I think that's about all about stem cells. I'm sorry if it wasn't as clear as I'd like, because it's not clear. It's not clear what's going on here with stem cells. A lot of people have ideas, and we encourage it. But as far as a straight answer on what things are, we don't have it. Not at this time. And I suspect it'll take many years before we get to the point where we can say this will help, because there's just a lot of other factors, that go on. Maybe I'll give you one other thing to think about here. When you're dealing with stem cells, you want to regenerate. Let's say it actually does do that. When you're dealing with, for example, a disc that is collapsing, arthritic, narrowing, falling apart, and you want to inject stem cells into it, the idea being it'll grow a new disc. Well, think of it as if you had a bridge, it's falling apart, it's, breaking off, and you had a pile of bricks and cement, and you're like, okay, I'm going to just put that on the bridge and make it better. It probably won't do that. You got to sort of tear the bridge down and redo the bridge, because everything's all falling apart. You got to reconstruct the whole thing. Just throwing bricks and cement on it, even though that's what was used to make the original bridge, that's not going to work because it's fallen down. You got to reconstruct it and mechanically change it. And that's one of the problems with stem cells too. When you're injecting in a disc, for example, that's all arthritic, the internal structure is destroyed. And what made the original disc isn't necessarily what you need to fix the disc that's now fallen apart. It's probably something different that you're going to need, because it's not going to do anything. It's not going to do much. Grow a lot of new disc in a collapsed disc, probably not going to help too much. And there's other challenges too, which I won't get into. But it's a lot to be thought about. Be a little bit skeptical about disc injections of stem cells in and around the spine. It's not necessarily proven, but we're hopeful, and we're trying to learn. There's a long discussion of we don't know yet, but people do ask. So there's at least part of an answer for you. And I'll see if I have any questions on stem cells and the disc, or on the spine. Or maybe everyone is stunned. No.
I have a couple questions.
All right. Have you ever
That's
performed
okay.
stem cells? Someone's talking, which is good. I don't know how we're getting voice, but that's great. Go on. Uh-oh. No
Okay,
longer.
sorry. No, so I have a two-part question.
Sure.
With the stem cells, I know that you said if the bridge basically, right, is crumbling, you can't just throw cement on top of it. So you'd have to kind of reconstruct it. I understand there's a lot of unknowns, but if in fact stem cells were to be utilized for a collapsing disc, how would you reconstruct that? Would you kind of remove the entire disc? And then what happens if you have a back where a fusion had taken place, so the disc has been removed? Is there any thought to how stem cells would maybe benefit somebody that was in that position?
The at least in my opinion, how they could be used is you would need to provide the scaffolding, so to speak, for the stem cells to work. When you're dealing with things orthopedic, when you're dealing with things spine, one of the important things to understand is the relationship between the cell and what's around the cell. For example, in something that's very like the liver, there's lots of cells and just a little bit around the cells, extracellular. In blood, there's a little few cells and there's a lot of fluid around the cells. In bone and in disc, there's very few cells compared to the lattice, we call it, the structure that around the cells. The cells are in there, but it's in this lattice work, this matrix, so to speak, that far outnumbers the number of cells. So if for stem cells, if it were to be used to work, it would need to have the lattice on which to work. So you can maybe inject, potentially, this is theoretical, you have your lattice, you inject your cells, and it begins to grow the additional tissue and fill in where it needs to fill in. But it has a starting point that it can use to begin to make that structure there. As far as a fusion goes, you're not going to turn a fusion into a disc. You have to remove the fusion and maybe put in some type of lattice for the stem cells to begin to work on. But as I said, it's not one thing that you can just add. There's a lot of steps that go along with it in the process. And another analogy, right? An analogy. Sometimes you need a process to grow something. Those of us who've had aquariums, for example, we build an aquarium. You don't just that aquarium has, for example, this number of fish, this amount of algae, this amount of stone, this amount of water, and that's the ideal aquarium that's working and living well. Well, if you want that, what you do is you put in the water and then you put in the plants and you put them in. I'm not building them in aquariums lately, but you do it in stages as they sort of grow on one another. If you take all of the elements in the perfect aquarium and you throw them in all at once, it'll die because the interactions haven't been established from one thing to the other, so they don't interact well. So you need to do it in a layered approach and get things interacting on the basic level, maybe the algae level, and you add the next level and next level, and finally you'll add the fish one at a time so that they adapt to the environment. You don't just put it in I'm like making a recipe. You just throw it in all the right ingredients, and boom, you got it. Doesn't work. Similarly here, you're going to likely need to have several steps for your stem cells, whatever it is, to work. That's one part, but there's a lot of other things you need to add in order to make it grow or make it do what you want it to do. So I don't know if that explains it a little bit better, but the answer really is it's going to be a process to do it. And right now we're not anywhere near that process.
Thank you.
You're welcome, Jamie. Form stem cell procedures. I've used stem cells on the spine, back, in the neck and the back many years ago. And the truth is, this been mostly after a procedure, patients own stem cells, this kind of thing, inject here and there. And I think it made them a little bit better than if they hadn't done it. That's purely anecdotal. I think it did made them a little bit better. I do. But not enough that it was dramatic. And I wasn't injecting into people who weren't having surgery. For example, somebody had a disc that we thought was the pain source. That's a whole other topic we've discussed. It may not be the reason a person's hurting just because it looks funny. But after surgery, hey, maybe I can get this thing to heal better and faster if I inject stem. And it probably helped a little. But that's very anecdotal, certainly was done in a controlled fashion. So I've used it. I have not used it for just someone who has a disc that's maybe a little dark or a little arthritic. And we think that that's the cause of the problem, inject it and see what happens. Some of my colleagues have done that and felt that helped. I have not done that. As I say, there are those who think it probably doesn't really work too. So we're not quite there yet with that. And I'm being told I have exceeded my coffee talk time. So there we're done for today, but we can continue. Coffee talk, stem cells. These are good questions. We would all like to regenerate all things, but not quite yet. So exercise, eat right, and that'll might do something. Anyway, it's Dr. Nucci from Nucci Medical. Thanks for today.